Well, there are some things in life we probably take for granted. Talking is one of them, for me anyways, and chewing without pain. But if you suffer from TMJ, those symptoms might be a part of your daily life. They don't have to be. Dr. Michael Firouzian with the Center for Family and Cosmetic Dentistry joins me, along with his patient, Mary. Thank you both for being here.
Thank you.
Thanks for having us.
Okay, Dr. Firouzian, let's start with the basics. Let's kind of explain what TMJ is. What are some of the symptoms we might see?
Sure. TMJ is actually, when we talk about TMJ, we're actually talking about TMJ disorder. TMJ is the joint itself. We all have two of them. So the disorder is actually referred to as TMD. And the most common symptoms are popping or clicking jaw joints. It could be difficulty chewing our food properly, opening wide enough to bite into a sandwich. But it can also be headaches and some other symptoms that may not be attributed to TMJ directly.
And that's an important thing to note because people out there who may have those symptoms might not even think it's a jaw association, right?
Exactly, yes. There are so many people that suffer from headaches, and they've been to all these different physicians, and there's no answer. There's really no clear answer other than maybe medications. And we can really help these people turn their life around who have been suffering from headaches for years.
Okay, now Mary, you did not have much luck until you met Dr. Firouzian. So first of all, I want you to tell me kind of what you were dealing with that led you to even start seeking treatment.
My symptoms started with pain in my upper back of my neck, back of my head, all over my head, temples. Terrible pressure behind my eyes, pain behind my eyes, pressure in my ears. I don't know how to describe it. And then lightheadedness.
Okay.
It got so bad where I couldn't drive. I really couldn't hold a conversation on the phone. I was basically miserable.
Did you have any idea that it was TMJ at first? What were you thinking?
No. Well, obviously, I went and saw my own doctor.
Yeah.
And he sent me to all kinds of specialists, 2 different ENTs. Who else? Oh, a neuromuscular doctor.
Okay.
I went to so many doctors, and oh no, you can hear fine, you can see fine, you can, everything's fine.
And you're like, no, it's not fine, right?
Fine. And of course, there was no blood, there was no, and people couldn't understand what when you can't show anything, there's no evidence of anything.
Right.
Well, it was terrible. I couldn't drive, obviously. It was pretty miserable. And then, I started having pain in my lower jaw.
Okay.
And individual teeth hurting here and there. And that's when I thought, there's something wrong here.
Right.
And of course, I had heard of Dr. Firouzian, and I thought, hey, he specializes in TMJ. This could be. And of course, I called, got in, and here we are.
And here we are. And you don't look like you're in pain today. So what did Dr. Firouzian do for you?
Well, I'll let him take
He
over.
can tell us.
But I'm not 100%. I would say 60, 75. I mean, to that area. I'm not done yet.
Okay.
So I will let him explain
how it all works.
How it all works and what's coming.
So basically, the way I approach it is first figure out, is the problem muscular in origin, or if there's something actually going on with the joint function itself. And luckily, in most cases, the problem is muscle related, and we can work with muscles and rehabilitate them. So once I decide or determine where that correct jaw alignment should be, then I will usually fit the patient with something called an orthotic, which is basically a bite splint. In her case, it's actually attached to her teeth. That helps to retrain the jaw muscles to hold the jaw in a very relaxed position. And from there, we, of course, monitor her symptoms. And then eventually, I will actually build up her teeth with caps or veneers or whatever. Sometimes I can do it orthodontically, move the teeth into that position. But that's the ultimate goal, is to find that sort of, I call it a sweet spot, where that jaw wants to be, where the muscles are relaxed, and then we try to capture that.
Okay, so the bottom line is, if you're having any kind of symptoms that could be related to that, come get it checked out, because there is a solution, and we can't wait to see you at 100%, Mary.
Yes, me neither.
All right.
Please, you don't have to live with it.
You don't. All right, thank you both for being here.
Thank you for having us.
us.